Today, the 10th October, it is known for World Mental Health Day. When we talk about mental health, it is related to emotional, physiological, and social well-being of individual in TFA format. That is how individual think, feel, and act. The mental status or the mental status disorders has typical reasons. The first one is altered brain chemistry or called as neuronal chemistry. Then individual genetic makeup and life experiences like traumatic experiences or abuse, sexual abuse. Post traumatic stress disorders is a best example of this format. Other reasons includes loss of beloved one, failure in relationship, etc. or a financial loss, financial setback. These are the certain miscellaneous reasons to have altered mental status. There are a variety of clinical manifestations or you call it sign and symptoms of mental health issues, which ranging from the normal alterations like excessive sleeping or reduced sleeping, excessive eating or reduced eating, too much of tiredness, feeling low, easy upset, frequent yelling, irrelevant fighting, etc., which, if unattended, may leads to harm to an individual or somebody else, suicidal attempt or and suicide. Up till now, when we talk about health issues, it is more related to physical health of an individual. Still in last 10 to 15 years, people talk about mental health. But prior to that, health was merely confined to physical health. But frankly speaking, if you study the physical illness, many of these have its origin in the form of one or other form of mental health issues, and hence this particular part need to be addressed. It has been observed that the stress and strain has significantly increased from the start of globalization, because in a globalized era it has been well documented that the level of stress increased by multiple fold, and hence individual need to learn how to handle the stress and cope with the stress. If an individual fails to do so, then it is exhibited into one or other form of mental health issues. As per the Diagnostic and Statistical Manual of Mental Health, 300 plus disorders are there which are called as mental health disorders, but 7 to 8 are prominently seen, which includes anxiety, depression, OCD, bipolar mania, schizophrenia, dementia, personality disorders, etc. But whether it is a common or uncommon, it must be addressed. Otherwise, the outcome will be very dangerous and life threatening. Apart from this, when we talk about the today's era or today's situation, typically with respect to the advancement in the COVID phases, the COVID has resulted into alarming increase in the complaints of mental health. Out of that, anxiety and depressions are more common. As on date, 5 crore plus patients are suffering from depression, and when it comes to anxiety, it is 4 crore plus in India. Almost 15 plus patients are of depression out of 100 patients of mental health issues, while when we talk about anxiety, it comes to 7. Almost one person out of 7 has one or other form of mental health issues, which is really a point of concern for medical fraternity. Typically, in the COVID phase 1, people experience a denial mode and a panic mode. Anxiety of survival and fear of death or fear of loss was prominently observed, and which has exhibited in the different forms of clinical manifestation. Even the storage of drugs like remdesivir, which was in short quantity at that time, was also an example of fear of loss. While in typically phase 2 or the wave 2 of COVID, the altered behavioral changes and altered mental health issues more was because of decreased, declined, or poor financial health. So it has its own presentations in the phase 2, which ranges from lack of confidence to an suicidal attempt. Bombarding of negative news, specifically on television, and the frequent news of loss of beloved one were the more important parameters in the phase 2. Now phase 2 is almost come to an end, but there are warnings related to phase 3 or wave 3. Expecting the wave 3, it has been observed that the people developed the typical symptoms called learned helplessness, and hence one or other format of mental health are seen in a common man or a common population. We cannot avoid certain things, but definitely one has to develop the skill to cope up with this increasing stress, strain, anxiety, so that it will not lead to an organic type of mental health disorders. Having balanced diet, adequate sleep, keeping the environment positive, having a good discussions and deliberations with family and friends like drain out session, giving the time to an individual called as self talk, meditation. These are the certain things which really can show a good effect, I would say positive effect, in the early phases of mental health issues. But certainly the mental health issues should not be considered that something to hide. Rather than if an individual feels or if the family member observe some or other type of this clinical manifestation, then immediately one must approach to a physician, consultant, counselor, and psychiatrician, because there are a large number of medicines and therapies available which can reverse this condition and give a new life, rebirth to an individual to lead happy and healthy life. It is also said that in mental health disorders, patient कहता है मुझे ज्ञान मत दो, मेरे तरफ ध्यान दो, and that is the most important formula to identify whether an individual is experiencing, showing the sign and symptoms related to mental health. So on this World Mental Health Day, I wish everyone a very good mental health and thereby happy and healthy life. Thank you. Take care.